Okay, and so for the next session, in lieu of Dr. Matt Cherches, it's going to be one of our faculty members, Dr. Mir Marmer, presenting regarding validation of use of previously collected Apple iPhone health data to determine current performance level.
Thank you. And last night, when I realized I was giving this talk, I found this picture to remind me that I still love these people, and good luck to Matt and his wife with labor and everything. All right, so disclosure is this study was done in the UCSF Human Performance Center with a grant we got. Background is that patients with injuries and fractures, and specifically, we often base our treatments on what we perceive as their pre-injury function. So they're low demand, high demand, low function, high function, and obviously this is very subjective. So we thought to take advantage of this new age where everybody, I assume everybody here in the room is wearing some sort of wearable, and if you're not wearing a wearable, you're wearing a smartphone, which is a activity measurement wearable. So everybody has them. So the question is can we use the data that's just routinely collected on your smartphone to make valid predictions of how healthy you are, or what's your activity level? So the purpose of this study was to assess the correlation between activity on the app that metrics that monitors your activity on your phone, and to correlate and to see if it correlates to actual laboratory performance lab metrics. We hypothesized that this is the case. Our methods was to take 11 healthy volunteers. We chose 11 because that's what the grant paid for. There was no fancy sample size calculation. We already demanded that these people are already using an app to record their activity. We used only Apple iPhones because it's very popular in this area of the country and this part of the country. And then we wanted to standardize as much as possible. Like I said, the UCSF Human Performance Center did the testing. And then we just use a simple correlation just to see if there's anything correlates between what's on your phone and the metrics on the lab. The metrics that were on the phone are routinely collected on an iPhone are step count, exercise minutes, flight of stairs, climb, standing hours, sleeping hours, respiratory rate, and heart rate variability. The Human Performance Centers record, this is the basic human performance test. It's VO2 max, grip strength, sit to stand, 6-minute walk, vertical jump, and timed up and go. So our results was we found some high correlation. For example, grip strength was correlated to your median heart rate variability in the last week. I also didn't mention, but we checked for every metric, the weekly average, the monthly average, the yearly average. So we did figure out what's the most important time period to measure it. Relative VO2 max, for example, was correlated to minimum heart rate variability, and you see the absolute max was correlated to maximum heart rate variability. So I don't know what to make of that, but those are the correlations. Jumping height was highly correlated to the maximum respiratory rate in the past month, and these are healthy volunteers, so it may be just they're exercising more, so they're breathing faster. I don't think anybody has COPD now in our resident volunteers, and some of them. Sit to stand, you can see some lower correlation, time up and go, heart rate maximum correlated to that. So this graph is not intended to be read, but it's intended to be looked at and qualitatively appreciate. The high intensity red is a positive correlation, high intensity blue is the negative correlation, like a perfect negative correlation, close to 1. And you can see there's a bunch of these. On the bottom, there's all the metrics on your iPhone in a weekly, monthly, and yearly average. And on the left side, you see all of the Human Performance Center metrics, and you can see there's a lot of dots. So this is just a pilot study, proof of concept. So should we pursue this to a bigger study? And it seemed there are some correlation. There is a signal, as we like to call it, here that there's some high correlation between the two. So we think that routinely collected smartphone data may contain accurate information about the person's pre-injury physiological health and activity level. Successful validation of this approach may offer clinicians a novel tool for objective preoperative activity evaluation, leading to more personalized surgical decision-making and post-operative rehabilitation regimens and goal setting. For the geriatric population, which I'm more interested in, that happens to use smartphones, objective quantification of frailties may be possible, which is a big deal. Our limitations, obviously, we used only iPhones. It was only 10 patients. It's very difficult to generalize. The Samsung measure the same metrics, the same accuracy. We don't know. But it does give us, it motivates us to continue and research this field. So in conclusion, initial results suggest that the bring your own device model, which just bring whatever device you have, may offer and will use it to measure your health, may offer an accurate insights regarding patient physiological capacity prior to injury, and future studies involving larger populations or prospective designs is justified. Thank you.